If this process seems to be so great, why isn't everyone doing it?
I'm gonna say something maybe a little controversial.
Someone is going in, having a big surgery, and the next day they're getting their permanent teeth placed. Our bodies don't heal in 24 hours. What's the catch?
It's not as easy as just like, I'll wave a wand and take a scan and here's the teeth.
Is the surgery part itself painful? Are they awake or asleep? I'm here with Dr. Anoni from Nuvia, and today I'm putting her on the hot seat to answer the biggest and most controversial questions about the permanent teeth and 24-hour process. You ready, Dr. Anoni?
Bring it on.
Let's get some clarity here. Nuvia claims to do permanent teeth in 24 hours, but what does it actually mean? 24 hours after what?
So Nuvia's process of permanent teeth in 24 hours is referring to the day that you have surgery. Within 24 hours, you are going to have the permanent teeth that you are going to wear, hopefully, for the rest of your life.
I have heard places say, though, that you can get teeth in a day. So how is that actually different?
Okay, that's a great distinction. So teeth in a day can refer to many different things, right? There's a lot of different ways that people will refer to the procedure of all on four. Traditionally, when you do same day teeth or teeth in a day, what you're getting is not a permanent restoration. What you're getting is something temporary that they may refer to as, a temporary or healing set. With Nuvia, the teeth that you receive 24 hours later, they're resilient, they're permanent, and they can be the ones that you wear in the long term.
So what makes temporary teeth temporary, though? Can you break that down for us?
Yeah, so there's a couple of different ways that people do the temporary teeth, right? In all on four, regardless of where you get it done, you're getting the surgery, right? So teeth out, bone level, implants in. Now, what happens after that is really what distinguishes this, right? So in the traditional or temporary teeth model, one of the ways that they do that is that they will take a full denture, with, what we call palatal coverage or covering the roof of the mouth. They will hollow this middle part out and then drill holes into it where the implants are. They'll then put this in the patient's mouth, put acrylic. You ever gotten your nails done?
Of course.
Okay, of course. So that same kind of material in there to attach the implants to this temporary. They'll take it out, polish it, whatever, and you have nails in your mouth, essentially. Yeah.
Oh my goodness.
But it's the way that the procedure started, right? Like when that was the only technology available, it was good, right? The problem with that is, have you ever broken a nail?
Of course.
Yeah. So sadly, this is a little bit more of an investment than a set of 10, right? So, having done the traditional method for years prior to coming to Nuvia, what we saw was breakages, right? This material is not as resilient, and it can certainly break throughout the healing period, which can really put the implants themselves at risk. The other way that they make temporaries is after the surgery, they'll do something similar. Well, they'll attach this to the implants, break it off of the implants, and then take it into a lab on site and mill something made out of, PMMA, same kind of acrylic-y material. I would say that option is slightly more resilient than the first option that I described, but we're looking at like denture option, PMMA option, permanent option, right? So with Nuvia, our lab works overnight to make those permanent teeth, and the next day they're delivered, and they have an indestructible core. Essentially, they're incredibly resilient, and they actually help to provide a really stable, in my opinion, a healing aid to the implants themselves. Okay, so let me just use this example. Let's say you break your arm. What happens after that? What do you get put on it? A cast. And that cast, is it flexible?
Mm-mm.
No, it's nice and hard and resilient. Why? Because that helps the bone to set and heal over the course of time. The way that bone heals, it creates new bone cells cell by cell that actually start to come together and integrate pieces. So when you break your arm, it's the pieces of the bone. But when you have an implant, that cell by cell process grows into the implants and locks them in. Anything to disturb that process can cause the implants themselves not to integrate in the long term. So taking that cast example, would you rather, as you're healing, have something that has a little play to it and may break, or something that you could run a car over because it's so resilient?
Definitely the second option.
What I've seen from my practice prior to Nuvia and with Nuvia is that really resilient arch aids in the healing process. And I think that because it really provides like cross arch stability. And so it helps the implants kind of stay in place while they're healing and allow that bone to form.
I am a little confused though, because you are getting this set at Nuvia 24 hours after. Our bodies don't heal in 24 hours. So is this process actually safe for the patient?
Totally. That is such a good question. So as we discussed, this is incredibly resilient. I wouldn't say that the permanent restoration is put in and then, the healing process is done. Like,
okay.
From what I see and from what I, do in practice, this arch actually helps the healing process along. As I mentioned, it does help to keep the implants stable in that position so that that process, osseointegration is what it's called, of your body creating new bone to grow into the implants, can happen really seamlessly. In my years of practice prior to Nuvia, I would say, I had seen maybe like a 90 to 95% success rate of the implants that were placed. And a lot of that, the failures that would happen would be within those first 4 to 6 months, right? When the implants themselves just wouldn't integrate. But at Nuvia, company-wide, our success rate is over 99%. I mean, at our center, for an example, we've placed over 15,000 implants. We've had under 100 maybe fail.
Wow.
I mean, it's really something that is significant from what I've seen.
With this process being super fast, you're talking about advanced technology, wouldn't this be super expensive? What's the catch?
You'd think so, wouldn't you? But you might be surprised to hear that the cost for full arch treatment at Nuvia is actually below the national average. And that is because we've incorporated technology, right? So we've managed to make the process more efficient as we're making it, that much more effective. And we're able to pass on those savings to the patient. A lot of people ask about the cost and what the financials would look like. Nuvia actually created a free cost guide that's free to download for any patient, and it answers a lot of those questions. Actually, we could probably put it down in a link below the video, if that works.
Yeah. So if this process, seems to be so great, success rates high, why isn't everyone doing it? Like, why do you not see it out there?
Yeah, that might be something that many people are wondering, actually. Nuvia has spent years in research and development, actually making this digitized and advanced technique come to life, right? It's not as easy as just like, I'll wave a wand and take a scan and here's the teeth. We have our lab that works 24 hours on site. My communication with my lab manager is tight. You can ask her, sometimes maybe a little too tight. But the incorporation of the digital process as well is really a game changer. And then obviously, the high quality materials that we use, the process itself, it continues evolving, right? Nuvia, I would say, is safely on the cutting edge. I wouldn't say that we're doing something, reinventing the wheel. It's still the all on four surgical process, but we've been able to make things more efficient. And again, from what I've seen, better for the patient in the long term.
I am curious about like the patient experience itself. I feel like, going into a surgery, I'd be nervous, right? So is the surgery part itself painful for this process, or are they awake or asleep, or what does that look like?
people come in to the office terrified sometimes. I mean, you think of people who have maybe been traumatized at the dentist and, as a child or something, and they're scared. They don't like pain. I tell most of these patients, like, look, if someone sat in my chair and was like, I love pain, bring it on, I would be like, we have other problems to take care of. But the process at Nuvia, I let all of my patients know, when you come in for surgery day, the first thing we're doing after you talk to your surgical team and, you're comfortable and everything, you go to sleep. You go night-night. Yeah. So very, very comfortable during the procedure itself. Now, it is a major surgery. Is there some postoperative pain? Sure. While you're healing, I would say an overwhelming majority of our patients will come back for their follow-up and say, wow, that was really not as bad as I expected. There's some patients who have a rougher time after surgery, but you do have postoperative, pain medication, and ice is your best friend. I would say that the peak of the swelling or healing will probably happen between day 3 and 4. And then slowly but surely, you should start to see things getting better each day. By the time patients come back for their 2-week visit, 99% of patients are like, I'm good.
Let's talk about the day after for a second. So someone is going in, having a big surgery, and the next day they're getting their permanent teeth placed. Wouldn't that be painful? What have you seen from your experience, of how patients are reacting to that?
Yeah. So the next day, that is a question that I get often because you're fresh out of surgery, you're swollen, it's, you're recovering. Like I mentioned, you do have pain medication to help manage through that. Honestly, I would say a good portion of our patients don't even end up touching the heavy stuff, and they'll just do ibuprofen and Tylenol rotating. Obviously, everybody's body is different, but that's what I've seen in my experience. When you come in on the next day, I would say, okay, so we've seen about 3,500 arches in our center. I can say maybe 25 patients I've had to give anesthetic to the next day when we're delivering the actual prosthetics. Okay. Let's not forget, we take all of our measurements based on what the patient's tissues look like fresh out of surgery. So the next day, those teeth can go in pretty seamlessly because that's exactly how they're built. Now, it's important that we deliver those teeth within a short window, right? The 24 hours, in some rare cases, maybe a 48-hour if a patient comes in on a Friday, if that's most convenient for them, and we give it to them on Monday. That's ideal, right? The process that happens in the bone with the implants, remember we were talking about that osseointegration with the bone building? The bone building doesn't start happening right when the surgery happens. In fact, for the first several weeks, the implants actually become weaker in your bone because your body is in an inflammatory state and your bone breakdown cells, you've got breakdown cells and buildup cells. The breakdown cells are in high activity, remodeling everything around those implants, right? So we do want to hit that window where we still have that primary stability from the placement during surgery in order to stabilize those implants. In those, 2 to 6 or 8 weeks after surgery is when the stability kind of dips a little bit. That's why many of these places who don't have the technology to do the permanent teeth in 24 hours end up doing the temporaries, right?
Interesting.
So like I mentioned, the teeth are designed based on the patient's tissues at surgery, right? So a day or two afterwards, they're going to be fairly similar. We put the teeth in, make sure that they're tight and won't be going anywhere. And that's how our patients heal for 4 months, right? Now, healing occurs and tissues change.
Yeah, that's a question I'm curious about because if your, swelling goes down, wouldn't there be this big gap that forms in between your gums and the teeth?
So, I do often receive questions about the gap, the dreaded gap. I'm going to say something maybe a little controversial. Space is our friend. The gap that forms over the course of the 4-month healing period, that comes from the tissues pulling back from the prosthetic itself, because as they heal and remodel, you'll sometimes get a little bit of space. 95% of the time, from what I've seen in practice, the space that forms is our ideal hygienic space. It is so much easier to clean when you have room to do so. At the 4-month mark, there is the option. Let's say some patients heal in such a way that leaves a very large gap. Believe it or not, I have had some patients be like, I'm going to keep this because it's so easy to clean. But most of the time in those cases, we'll actually, backfill those areas at the 4-month checkup. So we have the ability to address that. But yeah, the space is really important. So you can swish clean like that. You can use floss in between the prosthetic and the gum. You can brush all the way up to your gum line and actually get into that what's called the intaglio surface, or the surface that's actually underneath the prosthetic itself. So yeah, the gap is our friend, but we have to make sure that it's small so it doesn't interfere with speech or anything. And if it is large enough to interfere with speech or cause any discomfort, we have the option to backfill.
Is that going to be noticeable when someone smiles though? I would be concerned about that.
This is something that we take into consideration way before you have the teeth. When we are planning, right? The restorative doctors and the surgeons work together to address this. So during the surgery, as I mentioned, teeth are taken out, the bone is leveled, and then the implants or the screws are placed in the bone. That leveling process isn't just willy-nilly making sure that it's flat. We take a lot of measurements prior to the surgery, and part of those measurements are evaluating the patient in the chair as well as their x-rays. What do we look at in the x-rays? Lots of things. But when it comes to that transition line in the smile, we look at the sinuses. Those are air cavities that you have in your face, right? If you've ever had a sinus infection, you know exactly where the pressure is. Sometimes those membranes dip really low. In very rare cases, we'll have a situation where when someone smiles, honestly, probably like mine, where you show a lot of gum, those sinuses can dip to right around that level. If that's the case, then we do have to have a discussion, with hey, if you really crank your lips up like that, you may see a transition line between the gum and your gum, right? The prosthetic gum and your gum. But most of the time, that's not an issue. That's a rare case, here or there. I think we've had 2 cases out of the, over 3,500 in our center that we've had to address like that. And we're able to find solutions. But typically when we designate what the reduction or smoothing is of the bone, we take that into consideration so that we can actually hide that transition line in your natural speech and smiling. So yeah, it should not be something visible when you're just in normal interactions.
So what would the problems be if there wasn't a gap there?
So this is something that I've seen, even in day-to-day practice, right? When there is no gap, patients can't really floss. This is not shocking the world right now to hear a dentist saying you need to floss, but it is super important to floss, in particular with these prosthetics, because flossing, it brushes where the brush doesn't reach. Okay. In our mouth, we have a ton of bacteria. Okay. That bacteria accumulates on surfaces and forms what's called a biofilm or protective layer over it. Water alone does not break that biofilm. The water pick is necessary and excellent for taking out big chunks and kind of irrigating things, keeping them clean, but it doesn't break the biofilm. So what happens is that bacteria starts accumulating, getting bigger, leaching mineral from your saliva, and then it starts becoming hard and calcified. That's what calculus or tartar is. That can easily start accumulating on the prosthetic, and that can lead to gum inflammation, even a sore in your gum. It can also long-term lead to implant failure if you're not taking care of these, right? So So we want to set up our patients for success in the long term. Yes, we see you annually for follow-ups, but if you're not able to take care of these on your own at home, you're not going to be able to protect your investment. So yeah, we like to see that patients have the ability to care for them at home. And the best way to do that is to have enough space to do so.
So you said the healing process takes about 4 months. How long is someone actually down for? Like if someone's trying to get back to work, how many days is someone taken off? Does that look different for everybody?
So it might vary for people. My rule of thumb is typically give yourself a week. Some patients may need 2 weeks, but for most people, if they're not doing manual labor for their work, a week should be fine. Look, I see some patients come in for their, tooth delivery looking like literally nothing happened. Everyone's body heals differently, right? So there's a broad range of normal within our healing period. We've many times written notes for work or done things to just make sure that our patients have the time to recuperate properly and aren't, running like miles or, picking up heavy boxes and things like that 2 or 3 days out of surgery.
So you talked about water picking and flossing. Are these things hard to clean compared to like regular teeth?
That's a great question. So natural teeth have spaces between them. That's where you floss, right? If you are, someone with braces or you have a bridge or something like that, you're also likely incorporating water picking. Brushing is very, very important for anything that you have in your mouth because it helps to break up that biofilm mechanically, like we talked about. This is very different in some ways and very similar in some ways to cleaning natural teeth. The ways that it's similar is you're still brushing, you're still flossing, you're water picking, right? Again, if you have a bridge or an implant or something like that, you're already used to that. The ways that it's different is where you are doing these things, right? With natural teeth, you're flossing in between them and up into the gum on either side. With this prosthetic, you are threading the floss through, in between the prosthetic and your gum, and you're kind of windshield wipering against the prosthetic between implants. So if you have 4 implants, you're doing the space behind it, in between here, in between here, in between here, and behind it. So it is a little bit different, and that's where you're water picking as well. However, some of our patients come to us because they haven't taken good care of their teeth throughout their life. Others have medical conditions or other things, accidents, reasons that they might have lost their teeth. But even in those patients where oral home care is not a habit, this kind of changes the game because you are investing a lot of time, money, and energy into this upgrade to your life. And so, you have a real motivation to protect your investment and to make sure that now that you've taken these steps to making yourself healthier, to stay that way, right? So oral home care is, a golden ticket to health, in my opinion.
With this being an investment, like you said, how long are these things actually supposed to last? Because, I'm going to go in, spend this money, have a surgery. I would hope they would last a while, right?
The goal is for these to last you a lifetime, right? Once those implants or the screws are integrated into your bone, they're a part of you, right? Unless some crazy accident happens or some, serious negligence in home care, happens leading to an infection, those are a part of you and they're in there. These teeth are virtually indestructible. I mean, I don't know if you've seen, but Nuvia has put up videos of like running over these teeth with a big rig and like a car, whatever. And so these teeth should last you, long term. So it's certainly an investment in improvement of quality of life for the long term. Meant to last a lifetime.
So how would like an everyday person like me afford something like this?
Nuvia actually has a lot of different options when it comes to payment, right? We do offer payment plans and other financial options, which are broken down in the cost guide that Nuvia made. It's free to download, and with your permission, we can put it in the description.
I'll allow it.
And if you want to check out a real patient's story who had this procedure done back in 2022, you can check out Ricky's story. He goes through the good, the bad, and all of his experiences since having this surgery done.